Well, it's a story we've been following for several weeks now, an HIV outbreak in the southeastern part of the state. As we've reported, it's centered in 5 counties, but the governor this week called the outbreak a statewide problem and is encouraging, quote, swift action to get the spread of the virus under control. He signed an executive order yesterday allowing for a needle exchange program in Scott County. That's the county all the HIV cases have been traced back to. As Barbara Harrington reports, the needle exchange was part of a larger order declaring the outbreak a public health emergency.
The order comes after the governor met with residents in Scott County this week. It was his first trip to the area where the HIV outbreak is centered.
I think we need to move resources. I think we need to move personnel. I think we need to move new tools and flexibility into this community to stop this outbreak in its tracks.
The number of cases has climbed from 27 cases in February to 79 reported Thursday, and that qualifies the HIV outbreak as an epidemic.
When people think of an epidemic, they think of a lot more numbers than we're talking about here, generally, right? That's technically incorrect, right, Pam? It's an epidemic is when the number of infections is outside the norm.
But the growing number of cases also made it apparent the situation was more than the local agencies could handle. A lot of counties in Indiana, including Scott County, don't have the resources to test for HIV.
As the commissioner of the State Department of Health, I want anyone who wants to be able to get HIV testing and is at risk to be able to get it no matter where they are, and we will continue to work in that vein. Right now, we're focused on putting out the fire in Scott County.
The CDC deployed here to Scott County this week, and they're on the ground working with local officials to confront the outbreak. The governor's executive order gets more state agencies, including the State Department of Health, into the affected communities. It also gets more healthcare providers involved in education and testing. The virus is being spread exclusively through IV drug use. That's different than how it's usually transmitted. National figures show about 2/3 of cases are attributed to sexual contact.
The majority of cases have been traced to IV drug use of Opana, which is a prescription narcotic painkiller. Other cases have been traced to use of other IV drugs, including meth and possibly heroin.
It's just a manifestation of mental health problems, addiction, and our inability to diagnose and treat infectious diseases such as HIV, hepatitis C, and the like. And if we don't get it solved down here in Scott County, it's going to spread to the surrounding counties. It's going to spread to the entire state.
According to the American Medical Association and the Centers for Disease Control, giving drug users access to clean needles through exchanges is effective in reducing the spread of HIV. That's why Pence's executive order allows Scott County to ask for permission to establish a focused short-term needle exchange program to help suppress the outbreak. The State Department of Health must approve the program before it's implemented. But lawmakers are still considering a measure that would allow for a more widespread needle exchange program. During a hearing Wednesday, state legislators and health officials offered their support for an amendment that would require operators of a needle exchange to register with state and local health departments. The exchange would also be required to deliver information on drug treatment options in the area in hopes of getting users off of drugs.
Needle exchange is a harm reduction strategy. It's like the patch for smoking.
It is a completely false assumption today to assume that treatment's available. Most rural counties, there is no treatment for drug addiction unless you can afford to pay for it, and most folks have no money.
Governor Pence has said he opposes a large-scale needle exchange program. Supporters counter that a broader effort is needed to both contain the current crisis and prevent similar situations in the future. The Public Health Committee is scheduled to vote on the amendment next week.
According to the Centers for Disease Control, rural residents are nearly twice as likely to overdose on pills than people in big cities. The Scott County coroner told the New York Times this week that his office has handled 11 fatal overdoses since 2013.